So they have a sales process that often leads to maybe let's just say it's a $30,000 surgery, and that's a one-size-fits-all solution that people think is the solution for, let's say, breast cancer. So, and now they're looking at a breast cancer patient and they're comparing patient X, let's say it's Susie, to everybody that's ever had breast cancer before her, as though there's some consensus for all the breast cancer patients. And what you're saying is, I think, is what matters is not those thousands of other patients that have had breast cancer, but what's going on with Susie.
That's exactly right. So the way I would say people should look at things is, first, let's measure what's going inside of Susie, see what's there, and then based on those findings, then look at the research to see, given the fact that Susie has these markers that are high, what approaches, what treatments, what surgical procedures, what drugs had the best outcomes when you know that detail. What's happening right now is those details aren't being considered, and it's simply a one-size-fits-all. And since you mentioned the case of breast cancer, a good example would be, we see lots of women that get told they need to have their breasts removed and the ovaries removed and other parts of their anatomy. And then years later, they find out they have cancer in another part of their body. And what's missing right now is just common sense in medicine. You can't just remove body parts as a strategy to fight cancer, because there's no single test that tells you where cancer is all over the body that is 100% accurate. We don't have a technology that tells us real-time analytics for cancer cells. So if you, like, from your hair follicle to the top of your head, or maybe at my head, not too many hair follicles, maybe my bald spot, but all the way down your toenails, there's not a single test that says, hey, we found every single cancer cell. So because we lack that diagnostic capability, how are you going to tell someone, hey, remove your breasts or some other part of your anatomy, and that's going to be good enough? That's a statistical model. But do you want to be a number, or do you want to be a human being? Right. Nobody wants to be a number. But what happens is people are conditioned, they're being conditioned to ask really dumb questions like treatment success rates and things like that, which is based on other people. And that's, where people getting led off course. The goal that most people should be focusing on is, how will you help me and what's going on in my body? Right. And then once you understand what's going on in your body, then you can look at data on other cases. But if you don't know what's going on in your body, the data you're looking at could be the wrong data, and you can make a very poor choice based on misinformation.
There's one more. I know we're going to talk about the multi-lumen and this technology, but one of the benefits of talking with Dr. Tom and being able to ask him questions is we often get little nuggets of information that when I hear them, I have an ear for this, and I want to just get it while we got it. You mentioned who's overseeing. There's nobody overseeing. When you're searching for medical information, or when you're searching for, what's the best practice for this disease or that disease, and people thinking they got to see a specialist and so on, you said there's no one overseeing this. And I think that was really profound, because I can't speak for everyone, but I think that a lot of people, patients, we think to ourselves like there's a council someplace, like of the supreme doctors, where they tell the other doctors, here's what we're doing and here's what's accepted this year. But there really is not much of that, right? There's like the World Health Organization, or, Harvard or whatever. They're all working independently. So there isn't really like the NFL of medicine, is there?
No, there's not. See, what happens is there's incredible financial bias going, pulling everyone in a certain direction, which ultimately means some large company is going to make some money, right? And unfortunately, what happens, though, is that let's say that right now you had an interest of helping, let's say, a group somewhere. You study that group and you find what you find, it may only apply to that group. But as other doctors learn of it, they may try with other people, but it may not apply to them at all, right? So that's like, it'd be kind of like this. Imagine if I measure the oil level in your car and it's low. Mm-hmm. And I say, Matt's car needs oil. And now I tell everybody, you have to put oil in your car, right? because your oil level's low. And then someone would say, wait a minute, you never measured the oil in my car. And everybody would go, you're right. He never measured oil. And instantly, everyone would see that approach as flawed. But in medicine, that's never happens. It's like something new was discovered and everybody adapts it or embraces it because it's like the new finding, but they never question, does it apply to the individual in front of me? And all I'm saying is very logical. Just study the person in front of you. I mean, what I'm saying is nothing really new or revolutionary. Very observant doctors and scientists have been using this for years. Today in sports, one of the ways that a really good coach distinguishes himself or herself from, let's say, a poor coach is their ability to observe the individual. So you got, let's say, an elite track coach. He watches you run. He watches your running mechanics, or she watches your running mechanics. And they could see the difference in you're slow to start, or you have a short stride length, or you have poor turnover. They could see a mechanical challenge. And they know what to do to address your mechanical challenge, so now you're sprinting faster. But they don't do that same thing with every sprinter they work with because each sprinter has maybe different challenges. So it's that simple in exercise or in the sports world. Now we go to the medical world, and a lot of that stuff is totally just lost or ignored.
So I'm asked all the time by patients, what's the difference between personalized medicine and traditional medicine? And in traditional medicine, there's a singular approach. So you have cancer A, and for cancer A, here is a standard of care treatment. And after you go through the standard of care treatment and it doesn't work, typically there's not a plan B. There's not another option. So then patients are told, hey, there's nothing else that can be done. And so then they're convinced that, hey, there's no hope and we can't do anything else. Now, I want to contrast that in a personalized approach that we have at Causenta. We're going to measure all kinds of details within your body. And we're going to find lots of areas that we can actually improve your health. And then indirectly, by improving those areas, we're going to help you do a better job at fighting cancer. So where someone else would say, hey, there's nothing that could be done, we're going to say, hey, there's lots of opportunity here to improve your health and make sure that you have a better quality of life so that you're able to function and live life under your own terms and not just waste away in a bed in hospice somewhere and watch everything go by you as time passes on. So if you or a loved one has been diagnosed with cancer and you're looking to get help, I strongly encourage you to go to causenta.com and fill out the form at the bottom of the page and find out for yourself how we can help you.